Thank you again to all our panelists. I think before we go into the question and answer session, we have two polling questions. And I want to point out one thing that Lorraine said that really struck a note with me is we're all doing it because there are benefits. So copy and paste clearly is something that is appreciated by end users, despite all the challenges that are associated with, and has been playing an important role in documentation. But now let's go to the first polling question, Craig, if you can go ahead there. And the question is, do you think the use of Scribes is a sustainable solution to the documentation burden? I'll give you a moment to go ahead and answer that. And you will notice that we also have one more question that comes up in a moment about voice recognition. And we skipped the question about copy paste that because, as Lorraine already said, everybody's doing it. So. The answer to that is, to me, that it was surprising that there is a strong majority in this audience that think we should work towards a solution that does not require Scribes. So moving on to the third polling question, and then we can go to the Q&A. Do you think voice recognition will play a viable role in the documentation in the near future? And please go ahead and submit your answers. And the majority here is for a limited fashion for voice recognition, which contrasts to the previous question does not surprise me. And at this point, maybe we can get Judy to feed us again some question from the chat that she was paying close attention to, that we can then turn to.
I think it might be Kenrick for this session.
Sandrick, so yeah. Sorry.
That's fine, Chris. So for this panel, there has been a lot of lively discussion in the chat. So I'll start with some comments and questions related to the first presentation. So one of the things that folks talked a lot about was the value of breaking information flow between team members, and it was pointed out that a useful function of writing notes for clinicians is for them to think about the patient holistically. And then also for nurses, nurses help translate information from other parts of the interdisciplinary team to the patient. So I was just wondering if you could speak to the influence, what would happen if you broke out those functions into multiple people based on the presentation you gave. I think that's what people were getting at in that question, in those comments.
Yeah, thank you. I think that's a great question. And I think I think it's not necessarily either or. I think with Scribes, that's fairly limited. With the teamlet model, you have people supporting the documentation activity of the providers during the actual visit with the patient, but that doesn't preclude them from doing all those additional roles. So if a nurse, for example, I think Krasinski's model is using nurses rather than medical assistants, so they do the documentation, but then they bring all that additional value to the rest of the visit. And when it comes to education and assessment and all the things that nurses are so wonderful at, and then they do their own personal documentation related to their work as well. Same thing with triage, for example. Same thing with pharmacy. Some practices have embedded pharmacists or integrated behavioral health. So likewise with that sort of expanded team of teams approach, where each individual brings their own value to that process. Now, as someone pointed out in the chat, the poor psychologist doesn't have a scribe and the pharmacist doesn't have a scribe. We're getting to the point where now the nurses need a scribe and the medical assistant needs a scribe. And so I think that's getting at this idea that we're just shifting onerous and unnecessary and redundant documentation. We need to step away from typing for dollars, and we need to step away. For example, here's a great example. A lot of states, when prescribing opioids, you're required to check the state opioid database. And in our state, we're not required to, but our organization is promoting it. if I go into the record and I check it, and you can see that I checked it, I still have to check a box saying that I looked at it. And that's just a terrible redundancy. We should really be able to just run a report. And so if anyone asks, was Dr. Smith logged in and did he check it? You can go and look at that instead of making me put it into my note, which then also hides important critical clinical information. And then you get into this needle in a haystack problem of what's useful and what's sort of regulatory noise.
Great. So switching to natural language processing, there were, I think Dr. Crystal, you did a great job of talking about where we are now. There were a lot of questions about the functionality of natural language processing and thinking about dictation versus conversational language, and then also the capture of ambient, because there are products out in the market who are starting to capture ambient speech. And so could you speak to, if you can, if you've thought about any difference between dictation, the ramifications of this dictation versus capturing ambient speech to put into the record, and just possibly speak to where you think some products, where they've gotten to, like Nuance, for example, which someone asked in the chat about if Nuance has improved since you have worked with them.
Thank you for raising that very important topic. So ambient speech is actually here. There are some vendors that offer an ambient speech product where you can have your conversations recorded, and then natural language processing happens in the back end, and some machine learning will actually reconstruct your notes using concepts such as topic modeling to generate a summary of what you spoke. In Microsoft Teams today, right now, as you are talking, it will automatically generate captioning and a transcript of the words that you're saying. What's missing and what's not quite there yet is the summary. So we can capture the words. We can even do diarization, which is attribute the words I say versus the word he says to match up the right person. But to summarize something in a structure where it's the HPI, the review of systems, the assessment and plan, that's the part that's missing. And even the companies right now that have the automatic speech recognition and the ambient scribe products, there's still human curation needed on the back end to get it fully there. So I think we have maybe 5 or 10 years where this will become a thing we're all easily able to turn on, so that we don't need scribes for the nurses, we don't need scribes for the pharmacists, we don't need scribes for our scribes. The computer can be our scribe itself. But the important thing that I heard discussions about, and is very poignant, is what is the benefit of the creation of the note itself. There's a lot of literature in the education and psychology space that talks about recollection of information from the fact that you're actually having to either write it down or even keying it on the keyboard. And I have colleagues that, although we have residents and fellows that help to draft notes, they always write their own notes, because they'll say to me, I can't remember a single thing about that patient unless I write the note myself. So I just think it's important for us to also keep in mind some of the maybe hidden benefits of the pain of having to go through the process of generating a note itself, but also just what you need and not having to check off boxes just for the sake of checking off boxes for compliance.
Great, thank you. Going to copy and paste. Copy and paste is something that a number of people in the chat talked about, trying to completely erase it from existence, versus a number of people talked about how helpful it was for users. So Dr. Possanza, I wonder if you could talk about that tension between all of the quality and error issues that come with copy and paste versus the usability issues for users.
I think what the challenge is really is, how do you reuse information that's already there? I think people have problems that I have to type the same thing that somebody else already typed, maybe better than I typed it, or they wrote it more eloquently, or they understood that topic better than I did, or, you know, that's not my area of expertise, or why do I have to keep writing the same information over and over and over again? And I think that, you know, it's the same thing that people faced with the check boxes that we heard about earlier. There's too many clicks and too many checks. Well, it's the same kind of thing. There's too much to document. So what is that essential information? What is that key information that stays stable? And maybe that should live in a particular area of the record so that it always is accessible, or it's always, you know, able to be accessed and transferred. And maybe that can be logged differently than the clinical pieces that we need to know to really assess, what are we doing for this particular patient on this particular day, so that we really have more of a balance between having to copy that old information and having to really document what's the important thing that we need to know for this visit and share with this next clinician and this team that's going to be caring for this patient. And how do I explain it to the patient so it gets into their aftercare documents without having to copy and paste that information? So it really is about identifying tools that are going to allow us to use and to reuse information in a more efficient and effective manner.
Great. One last general question that was posed in the chat, and this is for everyone on the panel. Do you have examples? Do you see any examples where we can learn from other industries to improve the processes and documentation burden that we've been talking about this afternoon? So anyone can, Dr. Smith, I see.
Just in the consumer realm, but laughably, tools like Siri and Alexa and Hey Google, and just being able to enter commands by voice and being able to have this concept of a virtual assistant where you're not having to go to the computer to key something and you can say, order a CBC or schedule the next appointment for me in 3 weeks, and being able to parse out those words and turn that into the product that you want, and then capture that text and include that into a note. So that exists right now in the consumer realm, and hopefully we'll catch up soon here in medicine as well.
Yeah, I think one of the things that came up earlier was talking about presentation of data. So right now we have a mound of text that's very challenging to pull meaning out of it. There's data, there's information, but there's not meaning. And so I would say that probably within manufacturing and probably transportation, there are ways to take the data that's in systems and present it in a meaningful way. And for some specialties in particular, in a longitudinal way that helps you to give you a snapshot of understanding what's happening with your patient at any given time. I also do think that we're doing some work with open notes now around having the patient tell us directly through the portal, what is your chief complaint? What are your 3 main questions, and what has changed since your last visit? And those flow directly into the note, so that there's no confusion about that. And we're finding that to be very illuminating and helping us to focus on what patients need from us.
And I also think that we can't really forget what Ya mentioned, is the fact that, there are those visual clues. I mean, there's the things of how did we learn, about information to begin with? How do we personally process information? And those visual clues are really important. They help us remember. They help us remember the patient. They help us remember the circumstance. They contextualize things. And I think that's something that we really have to think about moving forward, is how do we, I think Zach had that when he was trying to say, in his handwritten diagram there, he was looking for something and he was struggling to get a diagram. And here's the perfect example. I had to handwrite it and put it in. So how do we take what was, in some respects, the good things that were associated with paper and better use them in the electronic format? How do we, use those tools to better, document what we need and to get us that information?